This really is a wonderful day for us in the Senate because we will be bringing to conclusion a very important effort that's going to help middle-class families across the country, help young people and small businesses. This is really about fighting for the middle class and small businesses and bringing the kinds of reforms that will bring down costs, save money regarding health care and education.
This is a great thing for America's middle class. A lot has been said about how this is going to help people that maybe don't have insurance or all the different kind of different people that this is going to help. But we kind of forgot about the middle class and how they're going to be helped by this in two ways. First, in the health reform bill, even those that have middle class Americans who have health insurance have been just one serious illness away from financial catastrophe. Because why? Insurance companies could cancel your policy if you got sick. So I've often said that in middle-class America, a lot of middle-class Americans have good health insurance until they get sick. And once they get sick, they can get canceled. Or they have annual limits. Or they have lifetime limits. 62% of bankruptcies in America are because of medical bills. And 80% of those are people who actually had health insurance. Middle-class America filing for bankruptcy because they couldn't pay their medical bills even though they had health insurance.
It's a glorious bill, and it's going to open itself up kind of like a flower in the springtime to the American people. And they're going to find things in there they never dreamed of, simple, basic concepts, which were sucking the blood out of middle-class families and folks I represent in West Virginia, a lot of whom would like to be in the middle class. So we cover people. We're proud of it. We take on the health insurance companies, and we keep taking them on. You know, they're the sharks in this whole thing. They're the sharks that glide underneath the water, and you don't hear about them, see about them, know particularly about them until they bite you. Then it's too late. So you take on the bad guys, and you encourage the good people. The doctors who want to serve, who believe in community service.
I'm very pleased that a number of us were able to work on the issue of small business costs, and was pleased to author the provision that provides an immediate tax cut of up to 35% for small businesses with 25 or fewer employees right now. The majority of people who don't have insurance are working. They're working 1 or 2 or 3 jobs. They're working at home in their garage or their basement as an entrepreneur. Small business people have been hit the hardest in terms of the cost increases and are the most likely not to be able to find insurance. And right now, as of today, the clock has started on a significant tax cut to help small businesses. We also will see significant reforms this year, including young people here being able to stay on their parents' insurance until age 26. We will also see significant investment in community health centers across the country to be able to make health care available to every family.
For middle-class America, this is a twofer in this bill that we're passing today, both on the health care side, but also on the education side for their children. And as Senator Stabenow said, now they'll have the assurance that their kids will be able to afford to go to college. And again, when they get out, they won't be burdened with huge debts. And in this bill, and I must say starting in 2 years, the maximum that any student will have to pay back on their direct loan will be 10% of their net income. Net income, minus their living expenses, rent, all that other kind of stuff. They'll never have to pay more than 10% of their net income back on the loans that they have.
So making a higher education available, as well as making health care available, are two issues that we're addressing and will complete over the next few hours. It's been the ambition and dream of many who have come before us. Tom has talked about, as Debbie has, Ted Kennedy, and his lifelong ambition in the 47 years he served here, having witnessed what happened to his own children, what happened to his sister, growing up, the ability, because of the financial resources of a family, were able to accommodate the needs of their children. But then looking around and finding families going through similar situations as the Kennedy family was, and realizing that the ability to get that kind of care, to get those treatments, to get that help, was not going to be there because they couldn't afford it. And that passion to change that was what drove him for almost the 50 years he served here. And so today we're going to complete that circle, if you will, and open those doors and make the cost of health care become available to all Americans, and the cost of a higher education, which is so critical, not only for these younger people standing behind us and these young children who are here, but obviously for our country in the 21st century.
My son Alex is a senior in high school. He's been accepted to colleges. One of those colleges requires that he have health insurance. I have here a letter from an application we filed 2 weeks ago rejecting him. This letter's no good anymore. He's got Pell Grant helping him to go. We're going to be able to get health insurance for him within the next 6 months. And I'm so thankful to the Congress, to our president, for following through on the reasons that we voted for them and representing us here. I wanted to read to you on Sunday, the day of the vote in the House, as a participant on Facebook. On Sunday afternoon, I posted this as my status. 2 weeks ago, we learned our health care premiums are going up 29%, despite only one doctor visit this year. 1 week ago, we applied for a new policy with another company and were turned down for a pre-existing condition, wondering what tomorrow will bring. At 11:20 that same Sunday night after the vote, I wrote on my Facebook wall, "I just had a life-defining experience. I walked into my son's room and told him that he can never again be turned down by any health insurance company because of a pre-existing condition he has had since I gave birth to him."